Have conversation, carry out the flow, and action.
Oh, wait.
Oh,
Oh, it's hurt everywhere. Oh,
Oh,
I didn't
can
feel
you tell me
nothing.
what's going on, Miss
Oh,
Redhead?
it's blood everywhere. Oh,
Okay, can you tell me what's hurting, Miss Redhead?
everything. My leg, my arm, my
Okay,
chest, my head.
uh, what happened? Did you get shot or did somebody hurt you?
A car crash.
Oh, okay, okay. Oh no, okay. All right, let's get you. All right, let me get you a wheelchair. Okay, we'll take you right on to the back. Okay.
Okay.
All right, Jen Mozzie, can we please get this patient to the rapid triage, please? She was in a car accident. We need to assess for injuries at this time. She's saying that she has pain all over, so we just need to assess from head to toe. Okay. We'll go ahead and get her in the wheelchair.
Well, Miss Redhead, I'm gonna take you in your wheelchair to the back and we'll do some basic routine work. So first we're gonna start doing some vital checks. So we're gonna perform a head to toe evaluation. And then we'll have the trauma team as well conduct an immediate assessment on you.
Okay.
All right, Miss Redhead, I have you here in the room. Okay, I'm gonna go ahead and try to remove your clothes. I just don't want you to do a lot of moving. Are you okay with me cutting your clothes? Not fast enough. All right, guys. It looks like our patient is passed out at this point. Let's go ahead and do the check for breathing. We'll do the ABCs. So let's check the airway first. We'll check for breathing and let's circulate. Okay. On my count, 1, 2, 3. We're gonna move her to this other bed. Ready? 1, 2, 3.
damn, she heavy.
We should administer a IV drip stat just to make sure she's hydrated through the process.
Okay, perfect. All right, and I went ahead and put the blood pressure on. I'm checking her vital signs, checking for her heart rate and her oxygen saturation. Vitals are good. Sorry, I had to drop that. Alrighty. I don't see any injuries on the top of her body. I do see a slight bruising right here on the right side of her chest. I see bruising on her legs. No bleeding on the outside. I need to go ahead and get some x-rays done so that we can see if there's any internal bleeding. And let's go ahead and get a machine set up to do a assessment. Let's just actually, she said,
What happened to the irate family member?
we want to make sure that she's doing okay with the
Where
head.
am
She's
I?
taking
Where am
care.
I? Who are you people? Where
Okay,
am
let's
I?
get this
Who are you
x-ray done.
people? Where
Miss,
are
can
you?
you please step aside with me for a moment, ma'am? The
Where
patient is
are
currently
you?
stable. Once we
Who
know
are
more, we'll
you?
fill
I
you
wanna know
in.
where I'm at.
Miss Dreadhead, it's gonna be okay. You just passed out for a little bit, due to your severe injuries. We're gonna go ahead and sedate you so that you can remain calm, so that we can complete the assessment and X-ray. Um, when we go ahead and put the anesthesia in you, you're gonna fall asleep for just a few minutes, and then once we're done with the procedure, we'll go ahead and wake you up. Do you consent to anesthesia?
No,
Okay, no worries. We have another way to go ahead and do that. Anesthesia isn't
I wanna go home.
Oh, I'm sorry, Miss Dreadhead. You're not going to be able to go home. You're in no condition to be able to get up right now and go home. I'm so sorry.
Yes, Miss Dreadhead. I have examined some internal injuries. It looks like there's some bruising on your right hand side, which is a sign that there may be something in the inside. And it's important that we get these X-rays done to ensure that it's not going to cause any issues with your health. Okay. So I know that you may be a little bit frustrated, and sedation is not the way to go, but we do have other methods that would assist. Would you be willing to help allow my doctors to help you?
Y'all gonna let me leave out the door?
I can let you leave. Maybe I can get this done as quickly as possible, and then we'll let you out, okay?
Sure.
All right. We just have to perform these x-rays. I just want to make sure there's no internal bleeding. You did pass out on us, so I just want to make sure that these CT scans and the MRIs are good, so that way we can make sure that we're discharging you in good health, okay?
Okay.
All right, Jen has prepared the X-ray machine. And then right after that, we'll go ahead and use this. It's like a sedation, but it's less invasive. Okay, and so I'm just gonna put this right on over. Okay, she's passed out again. Let's go ahead, guys. Let's get this X-rays completed while she's out, and then I'll go ahead and set up for the MRI. Okay.
Okay, I'll be right back. Let me just
Yeah.
take her over to X-ray. All right, the X-rays have been done.
Alrighty. I do not see any internal injuries. The bruising may just been from been impact to the car, which that's great. I've already set up the MRI. Let's go ahead, Jen, Dr. Jen, and go ahead and check for any injuries to her brain. Okay.
Okay, I've done the MRI. The results came back with no issues with her brain.
Okay. Perfect. Alrighty. We'll go ahead and
Patient is
okay.
not bleeding. I just went ahead and hooked her back up to the oxygen machine. Um, Oxygen levels are stabilizing, however, it's in and out. So we just need to make sure that we continue to monitor her. Mr. Trez had given her CPR, so she's back with us. And so, like I said, I placed her on the oxygen machine, and we're going to just monitor. She is in no condition to be discharged at this time. Is there a family member, anybody that we can call in the event that anything happens?
I did not see anybody come in, but let me see if I can try and locate Trez. When the patient